Hi, everyone. I'm Neelam Phadke, adult and pediatric allergist immunologist and Tertiana Fellow in Health Policy and Administration with the MGPO. And today I'm delighted to be able to talk with Dr. Ryan Thompson about skilled nursing facilities.
Neelam, thank you for having me. I appreciate the chance to talk about nursing homes and skilled nursing facilities. I serve as the medical director for Care Continuum and Complex Care for the hospital and MGPO, and I'm pleased to join you today.
Thank you. There's a lot of confusion around terminology itself, so I'm wondering if maybe you could start by just introducing us to the terms nursing home and skilled nursing facility and tell us what each one encompasses and how the two are different.
That's right. So I'll do that. So I think everybody has heard about nursing homes and skilled nursing facilities and the challenges they have faced across the COVID pandemic. I believe the latest statistic is around 62, I believe it's 62% of all deaths in Massachusetts have been in residence, either short or long term in nursing homes. Just quickly on terminology, so nursing home and skilled nursing facility are related terms. In fact, one is actually a subset of the other. So a nursing home is the general term for places where people live who need skilled nursing care on a consistent basis, in many cases permanently. A lot of people in nursing homes are actually residents there, so the nursing home is their home. There will be a subset of beds or patients within nursing homes that receive what we call skilled nursing facility care or skilled nursing care. Oftentimes this is rehabilitation, physical therapy, occupational therapy, and so forth, or skilled nursing care. And they're there for a short-term period until they recover and can go home. Some patients have a high percentage of residents. Others have more of a low percentage. It just depends on the facility and its makeup. But most facilities have a mix of both. So that's sort of the general. I think nursing home and skilled nursing facility are somewhat interchangeable. We tend to use the term SNF, which stands for skilled nursing facility in the hospital, which is where our patients go after discharge.
Sure. The numbers that you just shared are pretty staggering. Understandably, I imagine a lot of patients and families might be nervous about the prospect of being discharged to a SNF. Can you talk about what providers can say to patients and families whenever they find out that that's going to be the next step in their care to help reassure them or tell them a little bit more about what's coming next?
Yeah, absolutely, Needham. That's really, I think, the main point of this two things today is really as the hospital opens back up, as we start doing procedures again, as we start admitting more patients, there will be a subset of patients who will likely require care in a skilled nursing facility after discharge. What our providers should know is that these nursing facilities have really undergone a lot of change. I think it has been an undersupported component of the healthcare system in general. A lot of resources and accountabilities have come to these facilities from the state. There's a lot of new infection control measures. These facilities are being audited. These audit reports are available on their websites, on the Department of Public Health website. And they're also doing a lot of things for their patients in their facilities, such as surveillance testing. They're testing staff. They're doing symptom checking like we are. So I think the main message is that while we can never guarantee safety really in any setting from the virus right now, things are a lot better than they were. And I think we definitely want to encourage our patients and families to be engaged in the conversation. They should reach out to facilities. They should ask them what they're doing to try to keep COVID out. I will also say that most facilities, around 85 to 90%, have had some COVID. It's really not something that they can avoid. Though I think with the latest measures, they're doing a very good job to cohort patients, to keep staff separate, so there's really not mixing of patients. Their measures are very tight.
That's wonderful to hear. Is there anything else that you'd like to add about the state of care at the SNFs and how it may or may not differ from being in a hospital, particularly as it relates to COVID?
Yeah, so I think one of the things that we've learned through all this is that these facilities have just not had the resources or the supports. I know that we had challenges early on with personal protective equipment. These facilities had challenges that were manyfold more difficult than our hospitals. I think we're now catching up with the resource supports that they need to support patients. but really we're getting there. They're necessary partners. There's a clear interdependency between hospitals and these nursing facilities. We need them and they need us, and our patients are going to have to go there, and we need to continue this partnership. I think the last and maybe even the most important message of all this as we consider discharge to skilled nursing facilities is really to give, I guess, a shout out and a plug to work with case management. These really are our experts in the hospital around care in these facilities and post-acute care in general, including at home. And so to our providers, please communicate with and rely on your case manager. My own personal practice is to try to defer as much of this conversation as I can to the case manager on floors where I have patients, because they really are the experts. They're the ones that can answer the questions most of all. And we just really want to be there, I guess, more of a supplement to those conversations.
That's such a wonderful overview. Thank you again, Ryan, for joining us on Two Things today.
Thank you for the opportunity.